Assalamu alaikum and a very good day to all my viewers. Today we are going to discuss different OSPE stations regarding cardiorespiratory system. So let's start. This is a slide of cardiac muscles. You can see cardiac muscle fibers over here with intercalated discs, as all of you must be knowing normal histology of cardiac muscle fibers. Here you can see contraction band necrosis. These are the pink bands. They occur because of acute myocardial infarction, and the infiltrate over here is acute neutrophilic inflammatory infiltrate, which is a sign of acute myocardial infarction. This is a slide of cardiac tissue. Here you can see gross appearance of bacterial endocarditis. Bacterial endocarditis, it produces growths on heart valves, especially mitral and aortic valve. Mitral and aortic valve. These vegetations, they can be caused by numerous microorganisms, and Staphylococcus aureus is the most common one, especially among intravenous drug abusers. Very important slide. Jones criteria for rheumatic fever. It can be asked in Viva, it can be asked in OSPE station, so you have to be very careful about it. Major criteria, minor criteria. For major criteria, pancarditis, polyarthritis, chorea, subcutaneous nodules, erythema marginatum. For minor criteria, you have fever, arthralgia, prolonged PR interval on ECG, increased ESR or C-reactive protein, leukocytosis. Two major or one major and two minor criteria must be present to diagnose rheumatic fever. Classic slide of polyarthritis nodosa. This necrotizing inflammation can involve small to medium-sized arteries. You can see pink band over here. This pink band is of fibrinoid necrosis. The infiltrate, which is present all over the slide, it is composed of neutrophils and lymphocytes. Another magnified view of polyarthritis nodosa. Legionella pneumophila. On this slide, you can judge it is gram-negative rod, as it is having rod-like structure and the stain is gram-negative stain. So the diagnosis is Legionella pneumophila. This Legionella pneumophila can be grown on a specific agar. This agar is known as buffered charcoal yeast extract agar, BCYE agar. You can appreciate the color of charcoal over here. These are the colonies produced by Legionella pneumophila, gray-white colonies, round and smooth. We have chocolate agar over here. Colonies on this chocolate agar are smooth, mucoid, and gray in color, and the most probable organism is Haemophilus influenzae. Another microorganism known as Mycoplasma pneumoniae, it can be grown on Eaton's agar, Eaton, Eaton's agar, and the Specific colonies are having fried egg appearance. Diagnosis is Mycoplasma pneumoniae. Another beautiful slide of a microorganism, Bordetella pertussis, having its colonies on blood agar. Colonies are grey-white in color, smooth, mucoid. Some of the colonies are coalesced with each other. So you can't skip the details of the colony. Henceforth, you can't skip diagnosis of Bordetella pertussis. This slide is showing you lung tissue. This lung tissue is having two granulomas. Both of these granulomas are non-caseating granulomas, having chronic inflammatory cells all around, lymphocytes, plasma cells, and macrophages. The diagnosis is sarcoidosis, which is systemic granulomatous disease. In these slides, you can see lung tissue, and different fibrotic areas are present throughout the slide. You can appreciate over here fibrous tissue, fibrous tissue, fibrous tissue. So the diagnosis is lung fibrosis or pulmonary fibrosis, and it cannot be ignored as all the picture is very clear. So my dear students, best of luck for your upcoming exams, and thank you very much.